Good afternoon, and welcome to our second Protect Our Province BC briefing on October 27th, 2021. We begin by recognizing that we are broadcasting from the ancestral, unsurrendered, unceded lands of the close to 200 Indigenous nations on these lands we now call British Columbia. The over 12,000 years history of stewardship and kinship of the First Peoples of these lands need to be acknowledged as providing the kind of leadership that we seek. Protect Our Province is a grassroots group of physicians, nurses, health scientists, health policy specialists, and community advocates. We are working together to help people in BC stay safe by sharing accurate information about the COVID-19 pandemic in BC and advocating for evidence-based policies. Our ultimate goal is to end this pandemic. My name is Jennifer Heilman, and I am your host for today. I would like to respectfully acknowledge that I myself am speaking from the ancestral stolen homelands of the Musqueam, Squamish, and Tsleil-Waututh peoples. This land has never been relinquished, and it is important that we as settlers recognize that and do our utmost to uphold and work towards the 94 calls to action from the Truth and Reconciliation Commission. Can we start the slides? Thanks. For today's briefing, we are using a new format. Our main messages for this briefing will be: children do catch COVID-19 and there are consequences of that. That's the first one. Second, children transmit COVID at home and at school and the data limitations around that. And three, how we can keep children safe at school. We will see presentations by Dr. James Heilman, Dr. Lynn Filiatro, engineer Michelle Naif, and myself. We will also see an interview with Elizabeth Costa, a parent whose family is still enduring the effects of a COVID infection. Some presentations were pre-recorded due to availability. To start, I would like to introduce Dr. James Heilman, a BC emergency physician and public health advocate. His work as a medical Wikipedia consultant was featured in the New York Times during the Ebola outbreak. He will be presenting epidemiology regarding the beginning of this school year.
Thank you. I'm going to go over some data on COVID-19 rates among different age groups in British Columbia. First slide. Following the return to school this past September, we saw a significant increase in cases among elementary school age children, those 5 to 11 years old. Masks were initially not required in those in kindergarten to grade 3 in this province. And we saw this dramatic increase while other age groups saw a decline or a fairly stable rate of new cases. However, this data, which has age groups 18 to 39 and 40 to 59, does not allow us to tease out what effect, if any, the rise in cases among elementary school children had on their parents. Next slide. Thankfully, we have similar data with different age cutoffs. The dashed line once again indicates the start of the school year. What we see is that while cases decreased among the 20 to 29 age group and stayed fairly flat in the 50 to 59 age group, there was significant increases in the 30 to 39 and 40 to 49 age group, the typical age of parents of children between the ages of 5 and 11. This increase among parents reflects data we see from other countries like the UK. Next slide. Now, I'm not pushing for us to once again close schools. In fact, we have known for nearly a year that schools can be made safe with a number of preventative measures. Evidence published by the US CDC in December of 2020 found that the risk is low if there is consistent use of masks in schools, if there is testing and isolation of infected people, and if social distancing measures are in effect across society. Without such measures, however, schools are a significant risk, not only to the kids themselves, but to their parents. And back to you.
Thank you, James. We will now hear from Dr. Lynn Filiatro, who was an emergency physician for 20 years. She spent her career at Vancouver General Hospital, where she also served as the Emergency Department Quality Improvement Director. In 2016, she left clinical practice to co-chair a physician engagement initiative at Vancouver General Hospital, UBC Hospital, and GF Strong. She will speak to what the science and the data are telling us about children and COVID-19 in BC.
Thanks, Jennifer. First slide, please. So at the beginning of the pandemic, we had the false impression that children did not get COVID. In fact, we did such a great job at shielding them by closing our schools, limiting extracurricular activities, and that we didn't see as many cases in children. However, Delta changed this. And we now know with better testing that our numbers of cases in children mirror the rates in adults, and in certain settings can in fact be higher. Next slide, please. So when BC reopened the schools on September 8, we saw an escalation of cases in schools and in children from ages 0 to 19. We're dealing now with the Delta variant, which is much more infectious and much more transmissible. So when we looked at the data from September 5th to October 9th, when we looked at the increase in cases across the province, 26% of the increase was due to children from 0 to 19, even though they represent only 19% of the population. We know in BC, when schools reopen, we were well underway in our fourth wave. And in terms of mitigation measures in school, we had less than last year when we had less contagious variant. Next slide. Now, kids do get severe outcome. Lucky so far for us, what we found in BC is that now versus last year, the percentage of kids that get into trouble, meaning being hospitalized, needing ICU care, or dying, has stayed stable. So even though our number of kids getting infected has been bigger, the percentage that require hospitalization has stayed at 1%, ICU admission have stayed under 1%, and deaths also have stayed under 1%. Looking at the last report for Scituate for the week of 41, what we found is, in terms of another severe outcome, the multi-system inflammatory syndrome in children. In BC so far, we have 19 cases. Next slide. In my mind, this is the big unknown, long COVID. It's also been termed as the hidden pandemic after the pandemic. Long COVID is basically the symptoms of an acute infection that are prolonged and keep on going. And long has not been defined. We know that for some, it's been greater than 15 weeks. There's been cases as long as 1 year or more. We don't know how long will be. And when you're a child and you are 10 years old and you develop long COVID, that has a completely different ramification. Now, what we do know on long COVID in kids is that it's less frequent than in adults, but it does follow a pattern, a predictable pattern of symptoms, and can affect multiple organs in the body. Next slide. In the UK, where it seems they have absolutely no mitigation measures in schools right now, they are seeing high incidence of kids getting infected. Studies in the UK have talked about a rate of long COVID anywhere from 4% to 14% of patients or children who develop ongoing symptoms. Currently, the number in the United Kingdom of children that have developed long COVID, or actually of all the population that has developed long COVID, is somewhere around 53,000. So quite a big number. And this speaks to the precautionary principle. If you have a new syndrome that you don't understand the pathophysiology, and you don't understand what the treatment of it is and how long the symptoms will persist, it behooves us to prevent infection in all our BC citizens, and particularly our children. So now we're going to switch to a video where Jennifer will be interviewing Elizabeth Costa, who is a parent, part of the Safe Schools Coalition of BC. And she unfortunately was infected via her son and is still suffering from COVID, long COVID. If we can.
So good afternoon, Elizabeth.
Good afternoon, Jen.
I understand that you and your son caught COVID at the beginning of the school year this year. Tell
Yes,
me about it.
We did. My son started with his symptoms September 8th at around 3 o'clock. And by dinner time, he had really high fever and a horrible cough. And before 9 p.m., I had the same symptoms. He got his positive results on the 10th of September, and I got mine on the 13th.
Right. Were either of you vaccinated at the time?
I was double vaccinated. My son was not eligible yet to be vaccinated.
And so you caught it even though you were vaccinated.
Yes.
Now, we do recognize that being double vaccinated does protect against hospitalizations and death. But this obviously shows that breakthrough infections can happen.
Oh, absolutely. I continue to maintain my mask on and open windows at home. I have a filter at home. I can still contaminate other people, and I can also get the disease. Yes.
Now, your son, he had to go to the hospital at one point, didn't he?
Yes, we got mixed information from public health on the 12th after hearing my son on the phone and me describing the symptoms. I was told to bring him to emergency right away. I did. And at emergency, of course, I had to tell them that he was COVID positive and I had the symptoms. They made us wait outside for over an hour. And eventually we got to see a doctor in a completely separate area of the hospital who told us that we were misinformed and to just go back home.
What symptoms was he showing that made you worried enough to take him to the hospital?
The fever was hitting 40, and it could not be lowered with the usual Tylenol-Advil combination for children. And the cough was nonstop. It was really horrible.
I'm sorry to hear that.
Thank you.
And so now, have you both completely recovered since then?
No. My son is tired and he has some skin eruptions left on his face that came with the symptoms on September 8th. I'm exhausted all the time. My chest still hurts. I have a little bit of a cough left and I cannot smell yet. And it's been 7 weeks.
Wow, that is a long time. And how is that affecting your daily life?
Well, I have to take breaks, which is new to me. It's not something I'm used to. I've never taken breaks throughout the day. I like to work straight until I'm just done with everything that I need to do. It's affected my work and my performance. I'm doing less work than I was before.
Which is unfortunate because, you know, that's something that in this pandemic needs to be addressed really is that if people are taking a long time to recover from COVID and cannot work as many hours or to the same degree that they could before, that does affect the province's productivity. And it's through no fault of your own. If you're having these symptoms, then it is going to be difficult. Yeah.
Absolutely.
Yeah. So until your son is vaccinated, what precautions have you put in place for him?
Well, he's back at school now full time, but because children are allowed to eat unmasked inside, my son eats his lunch outside. And I've also tried to put a HEPA filter in his classroom. Unfortunately, the school district was not in agreement with that. I'm still trying to get the HEPA filter back in the classroom, and his teacher keeps a window open at all times.
Well, I hope you will be able to get the HEPA filter back in the classroom. We will be having an engineer talk about HEPA filters, and so I really hope the increased knowledge about how those can help in this situation will help you in your situation too.
That's great. Thank you.
Yeah. So what would you like people to take away from your experience?
I would like them to know that we're not completely safe. I believe that the vaccines assisted me. I'm here. I did not have to be hooked to a machine in the hospital or be away from my children. But we're not there yet. We're not at the point where we should go to hockey games or have children at school unmasked, eating together, playing instruments together. There should be the knowledge at the school, especially, and where there's vulnerable people, that we need all precautions that we can have in place, including masks, vaccines, space. There has to be less people inside a small room. And it's in the air. It has nothing to do with the little bits of plexiglass that we still see hanging in some stores.
Yeah, I agree. I think that all of these layers, it would really help to get those numbers down. And so I really appreciate your time in coming to talk with us and sharing your story. I do think it is important that people understand that it does take some time for some people to recover. Sometimes long COVID does exist. And that if we are double vaccinated, it could still take a while before you bounce back. And it looks like for your son too, it has been taking him a while to bounce back too. So I wish you both the best of health, and I hope you are going to recover very quickly after this so that you can have your life back.
Thank you very much.
You're welcome. I appreciate your time and your coming here today.
Thank you for having me.
Yeah. That concludes our first main message, that children can catch COVID-19 and that there are consequences from that. We now begin the second main message about transmission in schools and BC's data limitations. So BC's exposure notification system has been a complicated experience, not just this year, but last year too. The most accurate data available to the public has been from 2 volunteer mothers who run the BC School COVID Tracker database, a crowdsourcing initiative that verifies school cases via exposure notice or confirmed positive test result. The graph here compares October 1st to 25th from both years. September was excluded because the tracker site was just starting up at that time in 2020. On the graph, you can see that school cases in 2021, this year, are clearly outpacing 2020. The school COVID tracker moms verify that many positive cases that were reported to them this year have not been posted on the health authority websites. And not only that, but some public health letters have never ended up on the website. So that is a concern that we have about data. Next slide, please. In BC, we don't test people who are asymptomatic, even though scientific studies show that the majority of COVID-19 transmission happens when people are without symptoms or before symptoms develop. For an example of BC's symptomatic only testing policy, BC school notification letters continue to tell people not to get tested if they have no symptoms. So there is a possibility that we are missing the asymptomatic cases. BC has also constantly tested significantly below the Canadian average. That means other provinces are testing their citizens more. And Canadian epidemiologists, Dr. Colin Furness and Dr. David Fisman, two of our expert advisors, have both stated that BC does not test enough, and therefore BC's data is incomplete. Again, without testing enough, we cannot know how many cases there have been in BC schools. Another thing to note is that for this school year, testing centers were closed starting in the summer and not reopened, despite the Delta wave's high case counts. Examples are Surrey, which is now just one testing location for over 500,000 people, and the Duncan and Cowichan testing centers having closed on September 24th, forcing residents to have to drive to Victoria or Nanaimo if they need a test. This concludes our second main message about transmission in schools and BC's data limitations. We now begin our third main message about how we can keep children safer at school. Next slide, please. Note how the case counts of Ontario and Quebec are trending down, the two blue lines in this graph. And so what this graph is showing is that when places have more layers of protection, cases did not increase when schools started. And we're using Ontario and Quebec because they actually had more layers of protection than BC had in September. So note that the graph shows absolute case numbers as well. So it's not adjusted to per 100,000 people. That means BC's case numbers are actually much worse compared to these more populated provinces. What are some of those safer measures that Ontario and Quebec had? Well, both these provinces mandated masks for grades 1 to 12 in September, whereas BC only mandated masks for grades 4 to 12 in September. Also, Quebec is installing carbon dioxide monitors in classrooms with a goal of having one in every classroom by mid-December. So they are partway through that project right now. And the Ontario Ministry of Education has bought over 70,000 HEPA air purifiers for classrooms on top of what some districts already installed. We now introduce Michelle Naif, professional engineer. She's a PhD candidate at the University of Alberta in the David Joan Lynch School of Engineering, Safety and Risk Management. She will explain more about ventilation, carbon dioxide monitors, and HEPA air purifiers. Welcome, Michelle.
Thanks very much. So we can move along to the next slide. I'm going to do a quick review of some of the things that were cut off last week's presentation, starting with just a summary again that ventilation calculations for complex spaces like school buildings are a little bit difficult. And that's not to say they can't be done, but it's also not necessarily something that you want to embark upon, by yourself. The key information that we're looking for in doing ventilation calculations is we're trying to determine the heat and energy transfer in and out of the space, as well as the matter transfer in and out of the space. So the air going in and the air going out. There are a few ways that air quality can be assessed. The first one is what's typically done in a performance test or be done by a building contractor, which is measuring the airflow at different locations. And this is sometimes called a performance test. And what that's going to do is give you an idea of the average airspeed at key locations around the building. And that's going to allow you to calculate or estimate rather the total air exchange in and out of the spaces. Another way to gain insight into how your ventilation is performing is to measure the accumulation of different types of contaminants, particularly over a period of typical use. So you want to be making multiple measurements over that period of time. A really excellent proxy in the case of COVID for a measure of how many contaminants might be in the air is to measure the levels of CO2 using portable carbon dioxide monitors. This doesn't necessarily tell you how much COVID is in your space, but it is going to give you an idea of how much fresh air is pushing this exhaled air, which contains carbon dioxide, out into the space. Finally, important to calculating your ventilation performance is going to be a record of the temperatures that the measurements were taken at, as well as a record of the relative humidity. Both of those variables affect the performance of the HVAC system and the rate at which contaminants both settle out of the air and how the air behaves in the space. Next slide, please. As we talked about last week, there's kind of two main principles in building ventilation. The first one is actual air change, where contaminated or old air is displaced by fresh air. This can be natural. It can be accomplished with heat transfer and sort of just a natural draft, kind of windows to an exhaust. It can also be induced, so the air can be forced. What ventilation does is it removes these contaminants, even if the source of the contaminant is still there. So two ways that you can use ventilation to decrease your total exposure to an airborne contaminant is to increase the rate of fresh air makeup into the space. And another alternative is to increase the rate at which air is pulled out of the space or exhausted. The next area of ventilation that is also relevant in COVID protection is circulation. So this, such as my little image shows there, is moving air around inside the same space under consideration. So we have mechanical fans that can do that. They accelerate the airflow and cause it to circulate. The downside of using a circulation-based strategy is that you're not actually removing contaminants, and eventually they're going to mix completely into the space, and you are going to see an overall accumulation. Ways that you can use circulation to reduce your exposure include what I'll call an in-loop filtration. So that is something like the HEPA filters that we've heard mentioned a few times. That is typically mostly a circulation device that's taking air from the space, running it over a filter, often a medical grade HEPA filter, which will remove virus-carrying particles. And then it is exhausted back into the same space, but it's been cleaned. Another way to reduce the accumulation that any one person in the space is exposed to is to mix the air more thoroughly. So we can look at dispersion studies and see that an infected person is exhaling, contaminated air, and it is going to slowly mix with the air all around it. Dilution is relevant. The other people who are inhaling that air, if the air is well mixed by the time it gets into their breathing space, they're not getting as concentrated a dose of this virus. Next slide, please. So the three main principles that schools are using for risk management, we'll start with the first one, which is ventilation. The CDC and ASHRAE, two organizations that I have linked references to if you want to consult them later, have recommended that 6 air changes per hour in a space will minimize or sort of be optimal to protect the people in the space from infection with COVID-19. It is far more typical, even in modern kind of commercial HVAC, that you'll be finding more like 2 or 3 air changes per hour, and often quite a bit less. One of the key ways to increase the ventilation performance in any space is to have a performance test of your building HVAC systems and to ask the building mechanical contractor to optimize the system for fresh air flow. In any commercial facility, this is going to need to be done by a building mechanical contractor, but it is relatively inexpensive and doesn't take very much time. I have multiple contractors who claim that they can do an entire school in 1 hour. I've given the outside estimate of about 3. So if there is capacity in your HVAC system, you can significantly increase the level of protection of every single person in that building by optimizing your existing system. And there's an excellent study I included a link to in this presentation where they did exactly that and were able to see a significant reduction in infection rates. That leads into the next point, which is optimizing the system you have. I fully understand the challenges that most public schools are under. Upgrading your entire building's HVAC in the short term is just simply not something that is feasible. So a couple of things that absolutely will make the difference. Ensure that intakes, diffusers, exhaust vents, all the pieces of your building mechanical that you probably don't think about very often, make sure that they're clean and they're not obstructed by decorations or furniture. Consider in your particular space opening windows and doors. Remember, you're needing some fresh air sources and some exhaust sources, or you're sort of, not getting a whole lot of movement. But if you've got that flow established, now you're actually seeing ventilation, you're seeing air changes. Using fans or air movers to draw in fresh air, so locating them strategically near, for example, an open window or perhaps a fresh air intake. And using fans strategically to draw air out of spaces can also increase the amount of ventilation. Another consideration, particularly for classrooms, is consider the effect that partitions and half-height walls, different types of large furniture are having in terms of obstructing airflow, especially fresh airflow. It may be a good time to reconsider the classroom plan and just try and, you can use streamers, you can use other things to get an idea of how the air moves through the space. And you really want to try and move things out of the flow paths so that you get that nice ventilation. Next slide, please. So public health in Alberta has recently recommended something that a lot of people call aerosol breaks. This is an excellent technique for classrooms that does not cost anything. Even allowing 5 to 10 minutes of rest time for a space allows droplets to fall and allows sometimes a full air change to take place. Another added benefit to using this practice of aerosol breaks is the movement of students into and out of the space is a major fluid dynamic event. You're mixing up the air, you're kind of sweeping it out of the room. Aerosol breaks, if they're possible to incorporate into your planning, are an excellent way to reduce exposure. Another thing to keep in mind in classrooms is that different activities generate different rates and concentrations of contaminated air. So we know that physical exercise generates larger droplets as well as a higher volume of exhaled gas, but physical exercise and movement also contributes to mixing. So that's something to keep in mind. Other activities like singing and speaking loudly and intensely, we know that generates more droplets and higher volumes of exhaled gas. Also to note, singing and speaking tasks in classrooms are often done in one position. So techniques like alternating the style of the learning activities or following, a high energy activity with an aerosol break are all things that don't require you to touch your building HVAC system, but that can significantly reduce the risk of exposure. Next slide, please. On to circulation, and this one is quite popular because this basket of circulation-related controls includes these HEPA filters, it includes the box fans that a lot of people are talking about, and recirculating even air that is contaminated can improve mixing. You do get a dilution effect, and you can reduce the localized concentrations. You can use physical movement for that. So spaces where people are continually moving into and out of, they're getting a fair bit of circulation just from people movement. But mechanical mixing devices like fans can also be employed to do this. Filtering that circulated air can reduce the accumulation. The portable HEPA units get some very good experimental results. There are 2 studies linked at the end of this presentation if you want to look in more detail. One issue with circulation devices is that these are highly variable in terms of quality and performance. So units that are designed for use in homes are typically sized for, a bedroom or a small room. When you're considering a device to purchase, you want to make sure that you're considering the total volume that needs to be recirculated, so that you're getting the most bang for your investment. The other thing with filtration devices is, depending on the design and how they're built, we need to be really careful that they are not becoming little homes for other airborne pathogens like bacteria and dust particles. Improperly maintained filters are a serious building health hazard. And that's something to keep in mind if you're going to be investing in any of these devices, is to follow the manufacturer's recommendations for cleaning and maintenance. The box fan type I was quite interested in. It really appealed to my kind of engineer mind. I loved the idea of a solution that people could build themselves. I wasn't able to find very many academic kind of sources to necessarily support their use, but certainly it is possible that if they're positioned in the right location and they're built properly, that they may help. And there is an article that summarizes some performance overseas with those units. There are some problems with that approach, largely around noise, the size of the fans, and the fact that fans placed in sort of non-strategic locations can have the effect of directing concentrated contaminated gas towards people. So that's always something that we want to consider for adding a circulation device, is the direction of the airflow, because we don't want to be subjecting half the classroom to like highly concentrated loads of virus. Local fans can also boost the performance of your existing system. Again, placement and direction are key. There are very inexpensive ways to sort of walk around, for instance, a school classroom and try and get an idea of how air moves through it. You can make a big difference with a small investment if you're strategic in how you approach the problem. So there are a lot of possibilities there. Again, you want to direct air towards exhaust points, preferably not over a whole bunch of people while it's going. And you want to be trying to draw air away from fresh air intakes and get it to diffuse into the space. The only risk that I will raise here that is important is that local fans, local heating units, and even recirculation filters can impede the performance of a high-functioning heating system. This is a perennial problem in building maintenance. Space heaters can completely unbalance a well-designed HVAC system. So that is another consideration. If you're in the situation where the air in your classroom or your school is fairly stagnant, you don't have very good heat transfer throughout the building anyway, I mean, it's unlikely at that point that you have a highly functioning HVAC system. But the best choice there is definitely to get a qualified contractor to come in and assess it. And then looking at some of these additional controls, as sort of a second step. Next slide, please. I'm almost finished. So the final bin or sort of group of controls that we see for schools is source reduction. The source of a COVID pathogen is people in the space. So one thing that does help is to have fewer individuals in the same space wherever possible. We don't have a lot of options sometimes. As I mentioned earlier, alternating sort of what I call high exhaust activities, like speaking loudly, with sort of lower exhaust ones like silent reading or independent work, can reduce the total amount of source versus a plan where maybe none of that was considered. Staggering the occupancy of different spaces, again, this rest or flush time reduces overall accumulation, and staggering the occupancy where one classroom full of kids is there while another one is on a break is another way to just sort of bring the whole daily exposure load down a little bit. N95 or similarly rated individual masks used properly can cut the contamination in exhaled aerosols by up to 90%. Masks are a good alternative as sort of the last line of defense in this whole package of controls. Another threat that exists with COVID is things like tissues, soiled masks, the sorts of things that you produce in school by the end of the day. Storing these in closed waste containers or bags will cut down on the risk of what's called re-aerosolization. So if you're kind of blowing your nose into a tissue and throwing it into a waste basket, under certain conditions, it will actually kind of emit gas like aerosols back into the space. So that's another, potentially simple way to reduce some of the exposure risk. Those fomite contamination protocols, keeping surfaces clean, hand washing, all of that still help. It's not maybe the primary vector, but anything we can do to keep our building, overall healthy is going to help with COVID. And finally, the ultimate source of contaminated exhalations is someone who is sick. So students who are symptomatic or ill still absolutely need to be sent home. Last slide, please. Here I have included classroom and school-specific references, and the following slide is some more general information sources about heating, ventilation, and air conditioning, and that's all I have for today. Thanks very much.
Thank you, Michelle, for coming here and explaining all of that to us. We really appreciate that. So now that Michelle has explained how important ventilation is, I just wanted to point out in the next slide, the layers and protections in schools outside of BC. What are the other layers that other places are using, in particular the provinces of Canada? So the one after that, yes, that one, thank you. So I'd like to focus on the middle block right away, the ventilation filtration, because that connects to Michelle's presentation. So the Ontario Ministry of Education, they actually spent $600 million versus BC's Ministry of Education, which was only $87.5 million. Now, when you take student population size into account, BC would need to spend $77 million more to catch up with what Ontario did. So if Ontario can do it, then the BC government can do too. And that would buy over 100,000 HEPA air purifiers, according to cost calculations provided by a Canadian supplier who sold HEPA units to several Ontario school districts. Now there's also rapid antigen testing. That is the left box on the screen there. And that would be to catch positive cases when they're in their infectious stage. Canadian epidemiologist Dr. Colin Furness, who is one of our expert advisors, says that systematic testing should be used to find cases, including aggressive ring testing around discovered cases. So if someone is discovered to be positive, then how about using rapid tests throughout that class to try to find other cases that may be infectious and isolate them. Now, rapid antigen testing will actually be explained in more detail in our third briefing next week. So we hope that if you're interested, you will tune into that one. And then the last box on that screen there is about vaccinations. And certain provinces have actually mandated vaccinations for their staff, and other provinces have mandated staff vaccinations and then asked people who are not vaccinated to do rapid testing frequently, like regularly, to see if they have COVID, they would stay home. Now for BC, Protect BC, our province BC feels that mandatory staff vaccination should be a provincial decision and not downloaded onto school districts. All districts should have the same measures of safety rather than a patchwork of some mandated and some not. So note that some jurisdictions will do that regular testing, and that is an option as well. Next slide, please. So any pandemic response should really take into account that COVID-19 has a disproportionate negative effect on marginalized communities. On the slide here, it comments on how in the US, the death rate is much higher for Black, Indigenous, and Alaskan Native children, and that BC doesn't collect race data. Another place that has collected race data is the UK, and they have been finding similar effects. In BC schools, we have seen marginalized communities affected more than others when Surrey schools had more cumulative cases than the rest of the Fraser Health districts combined last year. And that should not have been allowed to happen. They should have been allowed to put more layers in place at that point. Pandemic responses should also consider medically vulnerable families. So not incorporating all the layers in our toolbox means that vulnerable and immunocompromised families are now having to face the impossible decision of having to choose between risking their health or not going to school. Safe schools or unsafe schools, they are exclusionary. Shouldn't these children have an access to an education too? And the fact that BC drastically reduced remote learning options for this school year has had a huge impact on these vulnerable families. Next slide, please. To conclude our presentation, knowing that children are at risk of catching and transmitting COVID-19 and that schools are congregate settings where children spend a significant time indoors, and that there are more transmissible variants that are circulating in our communities, Protect Our Province would like all of the layers, which have been proven useful in multiple studies now, to be implemented in BC. Some other provinces and other countries are using these layers. Why are we not doing so as well? If we want to drive cases down and keep schools open with minimal disruptions, these measures should be put in place. We will now begin our question and answer portion of this briefing. So I'm just enlarged my screen so I could read the question. It was really small before. Okay, so in terms of learning loss and social deficits to justify reopening, they're not considering the fact that there is learning loss and social deficits when there are COVID cases spreading through a classroom. And I am aware of many colleagues and parents who are reporting, that there have been multiple cases in classrooms. They've had to isolate. Their students are missing school. There's some kids missing school and then they come back. And then there's another group of kids that get sick and then they miss school and then come back. And it's pretty chaotic. So when you think about those effects, there's learning loss happening in those situations too, and also social deficits of the concern and worry that families are going through while there is such a disruption going on.
You nailed it.
Thanks. So in terms of testing, did one of you want to take that on, Lynn?
Yeah, I can take it on. As we know, BC tests mostly patients that are symptomatic. And yet we know that the pandemic or the spread of cases through this pandemic occurs mostly through patients that are asymptomatic. And that could be those that never develop symptoms or that are pre-symptomatic. So a resounding no, we're not testing enough to be confident about our number of cases, be it in adults or in children. I would just go even a step further. We seem to make it hard to test, which to me is even worse. I was on Twitter with a mother whose kid was exposed. She was concerned. The child was symptomatic, and finding a place that was open was next to impossible. And we're 20 months into this pandemic. You think we'd have figured that one out by now.
And I would add into that when I was interviewing Elizabeth for this briefing as well, she had mentioned that when she had to go get her child tested, she had to drive 45 minutes to get to the testing center. She was feverish at the time, and her son was feverish and having symptoms too. So it was quite an ordeal to have to do a 45-minute drive while you're actually feeling really ill and then having to drive back again. Well, in terms of airborne transmission, basically the contact tracing protocols are based on the understanding of this virus before we understood that it was airborne. And so I would say that our contact tracing protocols, if that's what they're following, is not sufficient at all.
Yeah, and I think we can add to that what we're learning with COVID, that it is such an efficient virus at replicating that even brief contacts can be significant. It's a complete game changer versus last year. So again, a resounding no in terms of contact tracing protocols in BC.
Lynn, would you like to take that one?
Yeah, so outside, we know outside is better, but it's not black and white. If you imagine, I know kids don't smoke, but imagine the child is infected and essentially smoking. So if your child is close contact with the infected child, they are at risk, particularly with Delta. So outside is better than inside, but I couldn't say no, and absolutely no, they're not at risk, even if they were outside. Very much dependent if they're very close to that child, for how long, and what was the weather condition. If there was a lot of wind, I'd feel better, but who knows? We don't know.
Michelle, this is a question for you. Oh, actually, let me read it out first. I should have been reading these out all along. This is not my first time being a host, so apologies for not reading it out loud. What is the best way to monitor the air in classrooms to make sure the filtration or ventilation standards are being met? Is carbon dioxide the best measurement or something else?
So that's a really good question. There is sort of one study that dominates in terms of air quality measurement, and the absolute best standard is to have multiple sensors that are measuring CO2, relative humidity, temperature, and have a separate measurement for particulates. Ideally, again, you have more than one of these, and they're at multiple heights in the classroom. And then, as opposed to just reading the absolute readings off those sensors, what you ideally want to do is put a sensor in sort of a neutral location, probably the hallway in a school. And what you want to be doing is comparing the relative levels between the enclosed space and sort of the more general open space. That is the peak in school health air monitoring.
Thank you. Okay, next question. What are the 3 biggest things a teacher with zero budget can do to make their class safer? And Michelle, you covered several things, which I think teachers could definitely do in terms of movement around the class and having those aerosol breaks. And so I'm really glad that you mentioned a lot of those. Is there anything else we can add to that?
So I think the biggest thing a teacher can do is to sit in the room with sort of the things we talked about today and evaluate methodically what your situation in this classroom is like. And once you evaluate, the existing air quality, have a thought about what the classroom was like last year. Did you have a problem with the temperature all winter long, or was it fairly well controlled? Once you've got an idea of what the status of your ventilation is, you can make a lot better judgment about your top 3 risk controls. I do think generally the practice of aerosol breaks is a really good one. I really like that. So that's about every hour or less vacating the classroom for a while. Things like alternating the types of activities, getting people to disperse in the classroom wherever possible if they're going to be speaking or something else that generates a fair bit of exhaust. Those are all things that will help, and they don't have a budget.
I can add to that too from lived experience being a teacher. So, some of the things that I've done is if we're going to do an activity that involves a lot of talking, so, the kids are going to discuss with partners, that kind of thing, then what I do is I take them outside. So I plan it for a day that the weather will be somewhat decent, at least it's dry and not raining. We take our chairs outside. We set up a little outdoor classroom in the middle of the field, and I explain it all on the inside first. So I give all the instructions in the classroom. Then we head outside with the activity and away they go. Some other teachers, what they've done is they've gotten clipboards and then they've taken them outside doing various outdoor learning things, science and that sort of stuff. And that has been helpful as well. So those are a couple other things that I think can be done with a zero budget to be a bit safer. And what is the best type of mask to wear in a classroom? So who's our mask expert? Michelle, would you like to talk to that?
Sure. So the best mask is going to be one that both fits properly, is clean and changed regularly, and fits closely to the face with a good seal through the whole range of the activities you plan to wear it. And ideally one that's going to meet the standard that the N95 filtration standard meets. That's the best. Soiled masks, masks that are changed infrequently, masks that don't fit well, the efficacy of those drops off at a very, very quick rate. So if you can only have sort of two of the three, the mask that fits well and is clean is a strong one. And if you can get those N95s, that's what I have my kids wearing. I don't mind telling you, I don't feel out of line saying that. Every day I send them with a disposable N95.
Yeah, and I think we should refer them to the website Masks for Canada. They have a lot of places where you can actually purchase the N95 equivalent, and both for adults and for children. So that's a good place to look at, Masks for Canada.
Yes.
Okay, and maybe just to reinforce the point, with Delta, we need to up our mask game. These homemade masks just don't cut it with Delta.
Especially when the children are indoors together for several hours and are, in close proximity. The occupancy rate of a classroom is much higher than the occupancy rates of many other places. So I think we really need to put in as many protections for our children as we can. So these questions, just so everyone knows, these questions were submitted from the public via Twitter. We had put out a tweet a couple of days ago asking for questions to be submitted, and we thank the people who did submit questions. We chose the ones that fit with our topic today, which is schools. So now, just asking our tech person, is this our last question?
Yes, that was the last question, but I
Okay.
see Lynn saying she has one more.
Okay.
No?
Yeah, Michelle, I noticed that you didn't talk about plexiglass. Can you tell us what's good or bad about plexiglass?
Oh, plexiglass is a fantastic material with many potential uses. But in the case of COVID, plexiglass is sort of being used as like a splatter guard, which may have a purpose in your particular environment. But I did mention in the presentation that using partitions that divide the space, especially partitions that go up to half a height or higher in the room, those can have a fairly significant effect in how the air moves through the space. And so that's definitely something to consider. So, I mean, if we're following the protocols where people who are sick and sneezing and stuff are not in the space, that's ideal. Maybe the degree to which we need sort of splatter guards is maybe not as important as some of the other controls.
Thank you.
Thank you. So I do have a conclusion once we are done with any questions. All right, so I will go on. So moving on. Thank you for tuning in to Protect Our Provinces BC's briefing on COVID-19 children and schools. If you want further information on the topics that we have brought up so far, please visit our website, protectbc.ca. We've put a resources page there with articles and graphics that you actually might find handy as you advocate for safer measures for our children. And Michelle, I think we will try to get some of those links that you sent to us uploaded on there too. So if anyone's interested, you can go check that out. We've also got some others uploaded as well. So please visit our website, protectbc.ca. We thank our speakers for their time. Thank you so much for coming out and lending your expertise. We thank the audience. We thank you for your time as well. And we hope to see you at our next briefing, which is going to be next Wednesday, November 3rd. The topic is going to be on rapid antigen tests and how they can be used in workplaces, long-term care, in the community, and in schools. Visit our website or social media accounts to confirm the time of the broadcast. We wish you all well and stay safe.